Hello and welcome to All You Need to Know About Health Share Programs. In this brief webinar, we will review health sharing programs and compare how they measure up to Obamacare health insurance plans. Let's get started. First, for those of you who may be new to the healthcare sharing concept, health shares are organizations that facilitate the sharing of healthcare costs amongst their members who share common ethical or religious beliefs. Health shares are not health insurance. These are groups of like-minded individuals who band together to share medical expenses in a mutually beneficial way. While health shares are not health insurance, they do accomplish the same end goal and serve the same purpose. Contrary to what some might think, the health share concept is not a new phenomenon. Health shares have been protecting their members from financial catastrophe for over 30 years, though they have become wildly popular over the last several years as health insurance premiums continue to skyrocket under the Affordable Care Act. This has created a huge demand for lower-cost alternatives for healthcare. Today, there's over 2 million hardworking Americans taking advantage of health share programs, and these health shares have shared over $2 billion in healthcare expenses to date. It's healthcare you can count on and afford. You see, health shares are much less expensive than Obamacare health insurance options. That is, unless you're in that small group of people who are receiving large government subsidies to offset your monthly costs. And health shares are exempt from potential Obamacare tax penalties in the states where they still exist. Another strength to some health shares is that they give you access to large provider networks, leveraging the power and flexibility of PPO networks. You see, PPO networks used to be the golden standard of doctor-provider networks before the shift to limited HMO networks under Obamacare. With a PPO network, you see who you want, when you want, in or out of network, and have access to doctors all across the nation. Even better, when you stay in network, you pay less by taking advantage of the pre-negotiated discounted rates. One important note to make is that all health shares are not created equal. Some very low-cost health shares are reimbursement health share programs, meaning that you have to pay up front and then you submit for reimbursement, which can take sometimes up to 6 months before you have money in your pocket. The plans we're talking about today leverage large PPO networks, which allow you to have a plan that works very similar to the health insurance plans you're used to. They get you pre-negotiated discounted rates and greater access to care. Lastly, we find that many of our clients are attracted to health shares because they don't force you to pay for benefits that you don't want or maybe that you're morally or ethically opposed to. Things like contraception or abortion or substance abuse, just to name a few. Unlike health insurance, health shares do require that you agree with certain beliefs. As an example, we'll take a look at One Share Health's statement of beliefs. We believe in the authority of Scripture and the sanctity and dignity of every human life created by God with special meaning and purpose. We believe that every individual has the constitutional and religious right and duty to worship God in freedom. We believe and agree in the biblical and ethical principle of sharing with those who are less fortunate and who experience medical needs. We believe and agree that it is our responsibility to God and our fellow members to engage in accountable, healthy living and to avoid habits and behaviors which are harmful to the body. We believe in the power of prayer to save lives, to heal lives, and to unite our members in a common purpose and community. And we believe that prayer should be a fundamental practice of daily life. Now let's take a closer look at the major differences between health share programs and Obamacare health insurance. Unlike Obamacare ACA plans, most health share programs do require a health history review, which make them a perfect fit for those of you who lead a clean and healthy lifestyle. Health shares do have a look-back period on pre-existing conditions, which can vary by health share, and they don't share in expenses related to those conditions initially. There may also be waiting periods on certain benefits and services under health shares, which vary again by health share. As I mentioned earlier, the best health shares leverage the strength and flexibility of a PPO network, so their members have control over how and where they receive care. Some would argue that the greatest strength to health shares over health insurance is, of course, it's much less expensive. The national average for an ACA Obamacare Silver plan for a family of 4, husband and wife age 50 with 2 kids is over $1,800 a month and has a maximum out of pocket of over $16,000 a year. That same family could join One Share Health's Classic Crown plan with a $5,000 individual sharing amount for only $855 a month. Over the course of a year, that family could save over $11,000. Just consider those savings. So let's recap. Health shares are a tried and true low-cost alternative to health insurance. They're exempt from potential ACA tax penalties that still exist in California, Washington, D.C., Massachusetts, New Jersey, Rhode Island, and Vermont. There's no enrollment period with HealthShare, so you can enroll any time of the year. There are currently over 2 million hardworking Americans protected under a HealthShare program, and those HealthShares have shared over $2 billion to date. HealthShares are a long-term stable solution to your healthcare, which means no more switching plans every year. HealthShares are ideal for health-conscious individuals and families. There are waiting periods on pre-existing conditions and some benefits, varying by HealthShare. You can enroll in a HealthShare anytime, so you don't have to wait until open enrollment to change plans. With some HealthShares, you can get a next-day effective date. So, if you're healthy and currently have an overpriced ACA plan draining your wallet or pocketbook with deductibles and out-of-pocket costs too high to even use your coverage, imagine having a healthcare solution that met your needs and saved your family $700 to $800 a month or more. What could you do with all that extra cash? I bet you could find a better use for it than to hand it off to an insurance company month after month. There's no better time than the present to start saving money. That concludes our webinar. If you're ready to take control of your healthcare and start saving hundreds of dollars a month, reach out to us now at www.hsaforamerica.com or simply give us a call at 800-913-0172. We look forward to hearing from you soon.